Hi, I'm Erin Thornton. I'm the Global Policy Director here at ONE. I wanted to thank you all for being involved in this program and taking the time to study up on malaria. It's such a critical issue. And I thought I would take a few moments just to tell you about my own experiences with ONE and ONE's experiences working on malaria. Just by way of background, the policy team here at ONE and my role is to try to make sure that we've got facts about these issues that are so critical to people across the African continent, and to then try to help the people either out there in the field across the country or policymakers have those facts to take action. Malaria really started coming onto our radar screen, I would say, pretty early on in our history. Really around the time that the organization was just starting up, we were focused on infectious diseases. It was sort of a new way to kind of put the alarm bells out there in terms of there are these preventable, treatable diseases that are killing millions of people, and we know what to do about it. We have the technology, we have the tools that we need. We just need the political will. And malaria has been around for so long, and I think everyone's just always felt that it was a fact of life and that it was just a condition of living in some of these parts of the world, even though we here in the States have eradicated it, and really it's a problem that this country did used to have to deal with and no longer does. So momentum really got going in the lead up to 2005 and the Gleneagles Summit, which now in 2010 we're spending a little bit of time looking back on. It was one of those commitments that world leaders made, and they made some targets to scaling up some of those tools with certain numbers of bed nets and making sure families all had access to bed nets to sleep under, which is obviously one of the most impactful preventative measures that you can have in fighting malaria. And since that time, I think with the increased funding that followed, because the world did get behind the idea of really launching a renewed effort to fight malaria, the successes that followed just triggered such an enthusiasm as to this is one of those things that we can address, and this is one of those things we can change. And the numbers are just staggering. You know, we're spending about $300 million on the disease globally. As recently as 2003, that's skyrocketed to $1.7 billion in 2009. That sort of funding has allowed for the rates of deaths from malaria to plummet by between 30 and 95% in some countries. So countries like Ethiopia, Rwanda, Zambia, an island off Tanzania called Zanzibar, where the rates have just plummeted when you really have a concerted effort to get bed nets to families and then to have treatment available also for people who fall ill. And the impact is amazing. You know, this is a disease where we still have 850,000 people dying a year, most of whom are in Africa, most of whom are young children. Those success rates, I think, give us all renewed hope, to the point where in the 2008 election, it was pretty exciting to actually hear not just the policy wonks like me, but candidates for the president saying things like, we see a future where there are no more deaths from malaria. And that's a commitment that I think we can really make a reality if we keep up. So now's not the time to stop. Now's not the time to rest on our laurels. It's the time to scale up, because we really know what we need to do now. And that's where you all come in as being advocates and being able to really bring that message forward. We've got some further targets that we need to hit. We still don't have everyone who needs a bed net sleeping under ONE. That's a simple solution, a lot of energy around that. We still don't have treatment available to everyone who needs it. But we do have plans out there that can be funded. We do have political will. We do have, you know, the tools in place. We've got the President's Malaria Initiative, which has been scaling up in countries all across the continent and really doing amazing work. We also have the Global Fund to fight AIDS, TB, and malaria, which really takes homegrown solutions that are technically sound and puts the people on the ground in power to serve their own communities. And we've got political will here in the U.S. through the Congressional Malaria and NTDs Caucus, which is putting some renewed energy into this. And those are the tools I know you guys are exploring and learning more about, and that with some more support can continue to do some great work going forward. You know, I just wanted to thank you again for taking the time on this. We're here as a resource to you all, but we really need people like you out there across the country spreading the message and doing what you do best. So thank you so much, and good luck with the rest of the course.